We're gonna do 1.5 minutes each arm and 2 minutes upper back, 2 minutes flank.
Well, good morning. Just getting started. Dr. J's in surgery with his first case of the day. This patient came in for a breast augmentation. This patient also came in for a breast lift. He's having lipo 360 done with Renuvion. So as you can hear in the background, Dr. J has gotten started prepping the patient for some liposuction with vaser. And we are showing this patient's procedures on YouTube, so if you'd like to see the camera flipped, you can join us over there. You can find it in our link tree. It's going to be all the way on the bottom. Once you hit the link tree, you'll just scroll to the bottom and you'll see the YouTube icon. Or you guys can type it in the search bar at Dr. Jeneby Plastic Surgery. Again, just getting started. Let me know if y'all have any questions, or if you'd like to reach out to our team. I'm going to go ahead and pin a form here that you guys can fill out. If you'd like to get in contact through that form, it'll provide you with a free quote.
Actually, you know what? I'm going to come on the other side. Oh, that's coming from there. Oh, yeah, it is a live. What was that?
Again, hope y'all are having a good morning. Like I mentioned, Dr. J's in surgery, as you can hear in the background. Dr. J is doing vaser, so that's just preparing this patient for liposuction. It makes it easier for the fat to be suctioned out. So that's that screeching noise that you hear in the background. But if you guys would like to see what's happening, again, we are on YouTube. There we flip the camera and you guys are able to see what's happening in the OR. So you're able to see Dr. J, you're able to see the patient's procedure. We don't show the patient's face, obviously for privacy, but we do show the procedures that are going on. And it just kind of gives y'all a better view, better understanding as to what's happening during certain procedures. A lot of patients will join us on YouTube before their surgery. Even after their surgery, they'll go back and rewatch the lives that we had when they were under surgery, just to get a better understanding as to what was happening during surgery when they were under anesthesia, because obviously they can't witness what's happening, but That's why we like to go live there for any of those who are curious. Again, they're linked in our link tree. So once you hit the link tree, you just scroll all the way to the bottom. You'll see the little YouTube icon. If you click on that, it should take you right over to our YouTube platform. Hey QT, how are you doing? Dr. J is currently in surgery. This patient that he's with right now came to see him for breast augmentation, so that's implants. And this patient also came in for a breast lift, lipo 360, Renuvion, lipo to the thighs, Renuvion to the thighs, and then there's going to be a revision from a previous surgery that she had done. She had a tummy tuck by a different surgeon, and so Dr. J is going to basically go in and remove some of that scarring, the dog ears, or revise it. It is a beautiful day. It's a little chilly this morning. But nonetheless, a wonderful day. But QT, just let me know if you have any questions. As you can hear in the background, Dr. J is just doing vaser right now, so prepping this patient for some liposuction. But later on, we'll end up showing the breast augmentation. We'll show the breast lift. But until then, it's just going to be liposuction. And we're also showing this on YouTube, so over there the camera will be flipped and you will be able to see what's actually happening instead of like me just explaining it. You'll be able to watch it. And like I've mentioned, you can find that in our link tree. Find that in the link tree, or you can search for it yourself at Dr. Jeneby Plastic Surgery. Hey Princess, how are you? Thanks for coming on bright and early. Yeah, QT. Again, let me know if you have any questions. So we'll get to show a lot of this patient's procedure and the next one as well. And we just got started, so there will be a lot more to cover. Okay. Yeah, let me know if you make it. Leave a comment once you get there. What is the procedure? Yeah. Hey Patty, so this patient came to see Dr. J for breast augmentation, breast lift, lipo 360 with Renuvion, and there's going to be some revising from a previous surgery that she had with a different surgeon. She had a tummy tuck a few years back, and what's left of her tummy tuck was some scarring around her dog ears, by the dog ear. And so Dr. J is going to go in and basically take care of that for her. And then Dr. J has a second case later today. These two patients are mother and daughter, which is really interesting. So Dr. J's second case is going to be the daughter, and she's getting a removal of some old breast implants and a replacement, along with some lipo in certain areas. Hey Anna, what's going on? Are you having surgery soon? What's a 360? Yeah, Princess. So lipo 360 is basically liposuction around the entire midsection. So your abdomen, your stomach, your sides, your back, just that whole, that entire area that's encompassed in lipo 360.
I need to talk to Jay on it. It's not suctioning real well.
Okay.
That's one of the nurses that come in.
Okay. Hey, Dea.
I think that just needs to be snapped down that top.
See the green top, but maybe just a little, not 100% connecting.
Dea.
Get snapped down. Yeah, right there on the edge. How about this right here, this top, on the left? Yeah, turn that one. Yeah, that one. Put it all the way.
Oh, I think it's right here.
Oh,
There you go, you got it. Thank you, sir. I knew there was a little breach.
Alright, sorry about that. That's cool. Yes, indeed. So, like I was saying, lipo 360 just encompasses that area, your the stomach, the back. So, what'll happen is if you were just to get lipo 360 done on any given day, it will start out with you on your back, or excuse me, on your stomach, and Dr. J or whoever will go in and basically section that fat that's along your back, your lower back. There could be some areas where maybe more attention is paid to, so like your upper back, or your lower back, or your sides may get more attention than other places. And then what will happen is you'll be flipped over, and then liposuction will be done on your stomach, your lower abdomen, on your sides. So that's what you can expect for lipo 360. Again, like, some attention is paid to certain areas more than others. Some people want like more fat suction from specific areas. Is arm surgery safe? So nervous. Yeah, Anna. Nervous. Just nervous that like something will go wrong. Can I ask who you're having your surgery done with? Are you just getting an arm lift? Obviously your provider, your surgeon, whoever's doing your surgery, is really important that they have the right credentials to be doing it, that they're safe, that they are trusted. Generally, I would say you have nothing to worry about. There's always a risk when it comes to having any surgery done. So whether that be you being at risk for a slight, infection, or, it's not guaranteed that you'll have a risk, but there's always a slight chance that you could run into some risk after surgery. And with it being a real invasive procedure like that, I wouldn't worry about it, but I mean, as long as you're taking care of yourself after surgery, you should be totally fine. If you have someone to look after you, um, your recovery process should go really well, and therefore you shouldn't have any
200 upper
complications, any serious complications. Who are you having your surgery done by? Are you coming here to San Antonio? Is Dr. J doing it? Is one of our other surgeons going to be doing your surgery? Oh, I gotcha. Well, Anna, I'm sure your results are going to look amazing, come out spectacular. Again, there's always some risk that can be involved during surgery. You just have to understand that. But the likelihood of you running into any serious complications are very slim. My doctor's 70. Yeah, well, it sounds like you must have a lot of experience then. So that's always a good thing, but yeah, do your own research, make sure you choose wisely, and you feel safe at the hands of your surgeon. Yeah, Anna, that's awesome. That would make me feel reassured. Again, as you guys can hear, Dr. J has moved on from vaser and is now doing liposuction on the patient. So earlier, Dr. J was just doing vasers. That just helps to kind of sort of liquidize the fat, so it's easier to suction out. So it's easier to pull the fat out. And so that's what you can hear going on in the background right now. After liposuction, Dr. J will go in with Renuvion. And for those of y'all that don't know, Renuvion is just a skin tightening add-on that is used in areas where liposuction is done. So in the areas where Dr. J did liposuction and vaser, he'll go in with that Renuvion tool, and it works by essentially heating up the skin underneath, causing it to contract and shrink, and therefore on the outside gives a tighter appearance, and therefore tightens the skin. And so we're also showing this on YouTube. Again, for those of y'all interested in seeing, you guys can join us over there. And it is linked in our link tree.
Like 500 dollars.
Yeah, Anna, so to go live during surgery, we have to be in the OR to basically answer questions during surgery, to kind of explain what's happening, what Dr. J is doing in surgery, and then if the patient consents to it, showing the surgery. So we do that for the patient, we do that for our followers, we do that for potential patients, future patients. So yes, to answer your question, yes. And it is safe. It is safe because I'm not interfering with the patient at all. I'm not touching anything that will be near the patient or interfere with their surgery. I'm allowed to be in here. I'm basically just like tucked in a little corner, as you can see. I'm not really interacting with the patient, just kind of standing here. So like nothing I would do would interfere with her surgery or like raise alarms for any kind of issue as far as like, you know, sterile code or something like that. So let me know if you have any more questions about that. What procedure is better when you had kids? 360 of a tummy tuck? Love. Or a tummy tuck. Okay. That's a great question. It's going to vary patient to patient. Hey, Dr. J.
Hey.
What procedure is better when you've had kids? Lipo 360 or a tummy tuck?
That's hard to tell. It depends on your age, how much skin, what your goals are. If you have a relatively flat abdomen, not a lot of loose skin, not a lot of hanging skin, not a lot of extras, then lipo 360, I mean, that's almost no stretch marks. Just a tiny, tiny pooch. Then
Okay.
lipo 360, although it's not mutually exclusive. So you can get lipo 360 and a tummy tuck, which we do a lot, as you know.
Yes.
So we don't know until we see you, because that's a hard one to 100% say without seeing you.
Got it. Alright, Princess, let me know if you caught any of that. So basically what Dr. G said is, you know, it's going to vary like on your age, what your condition is like after you have kids. So if you just have a little bit of fat and like you don't have a lot of sagging skin, you may get by with just lipo 360.
Wow, Doctor, maybe on the second one.
Dude, it's pretty impressive. Wow, it's impressive.
Yeah.
Yeah, a little bit.
Yeah. If you'd like,
So
we
I had a lady
can
come yesterday.
set you up with a consultation.
82. She wants a lift. Just a standard lift.
I'm
She has a
37.
watch
I have a
hand
big stomach.
Chronic AFib.
I got you,
So I said,
Princess.
we need your cardiac clearance.
Yeah.
We need something kind of a note.
Well, sometimes
gonna
if it's
have you
just
just do
fat,
Kiva, 'cause
you
Kiva
can
works on
get
her.
by with just lipo 360, like Dr. J said.
A bunch of other
If
surgeons
it's not
on
really
Kiva.
like the sagging
I said,
skin.
just give me whatever you can from your doctor. Going today.
And we will,
No.
we're going to set you up
with.
with a
She's on
consultation.
propranolol for the AFib. I said, take it the morning off. Yeah. I didn't think you'd have a problem with it. As long as we get clearance in it. It's a simple lift. I told her I could do it actually under local. But she's a chicken. So I said, worst case. Yeah. She's like,
We can
real
set you
funny
up with
lady
that
from Fairfield.
consultation. I went ahead and pinned a form, Princess, if you're interested.
Like, the
It
only
can be
person I trust
virtual,
is
so
you
like through a Zoom
here.
call or FaceTime,
Certain
or
things.
in person if you're in
I
San
didn't call you yesterday
Antonio.
about it,
And
but
like Dr. J
I know
can
what to do
advise
with
what
it.
he thinks would be best.
yeah, she's getting an echo today. It's probably a good idea to switch now, Doc. What do you think? that fat there.
Yeah.
That's almost 2 liters, which would be around 3.8 pounds of fat.
Oh my gosh.
And fat doesn't weigh a lot, so to get fat is good. So anyway, I'm just getting her echo today. She's followed regularly by cars. They're normal people.
So Dr. J is still doing
I
liposuction
figured it takes
on this
us
patient.
30 minutes to
This
do a breast lift.
patient's
Tiny
case,
breast, tiny lady.
with it being lipo 360,
No
only
implant,
been
no
on the
pain.
back side. Have yet to flip
Just
her over
normal
and
stuff.
finish on the front. Let me know if you guys have any questions about that. Like I mentioned, this patient came in for a breast augmentation, a breast lift, lipo 360, and renew beyond. How much weight do you have to get work done? Great question. It's going to depend a lot on your numbers. So like your height, what's healthy, like your BMI. As long as it's under, what's a good BMI, I would say would be like 35 and lower. That's kind of ideal. Anything higher than that, some exceptions can be made. Some exceptions can be made to that rule, but generally, for example, Dr. J would like, it's safer for patients to be of a BMI of 35 and lower. Hey, Dr. J.
Yes.
Is there a ideal weight that, a patient should be at before surgery?
Well, it's not a weight, it's kind of a BMI.
Right.
Because you could be 4'11", only 150 pounds, which is normal for a 5'8" person.
Right.
So they go by BMI. You can use a BMI calculator, and sure, if you're a bodybuilder, like a real bodybuilder, your BMI is going to be higher.
Yeah. Okay.
But we'll make the determination. So anything, ideally we'd like to see under 30. If you can't be under 30, 35 is better. I mean, is a decent kind of thing to be under. You're still overweight.
Yeah.
I go up to 38 for certain things because I'm a little bit more experienced, but ideally under 30 BMI would be fantastic. And you'd have a better result.
Okay. What's like a good BMI for somebody that's 4'10"?
300. A good BMI, well, the BMI is the same. It's under 30.
Okay.
So if you plug that thing, you do a BMI calculator.
I'm sorry, what's a good weight?
A good weight?
Yeah.
410. I would say 95 to max of 120 would be a BMI under 30, but you have to check my measurements. It's going to BMI calculator. I would say 95 to 120, Doc. What do you think? Would be
Probably,
ideal?
you could probably go a little bit higher.
Maybe
weight.
130.
Yeah, that's probably the max out your.
Okay.
If you're over that, then your BMI is going to be over 35. And as your weight gets up, issues arise in anesthesia and your post-op result, how you think it's going to look.
Okay.
So we do have ways you can lower your BMI. We have a weight loss program with GLP-1 with a weight loss nurse. And our prices are very, very good. She also can start you on NAD shots, Lipidin and B12 from fat burners. We have a lot of options to get your BMI under. A lot of people think they can do it themselves, but there's an 80% relapse rate just because they're hungry. I mean, hunger, unfortunately, the hunger area in your pituitary, in your brain, right beside the thirst area. So sometimes you're just thirsty, but then you eat, and then stress eating, boredom eating, Basically, we eat all the time.
Thanks for all that info.
Yeah. We can actually make another video, although we did talk about BMI.
Okay.
We can make one on break points.
Okay.
4'10" to 5'2", 5'2" to 5'7", 5'7" to...
Yeah.
Like the marginal tax rates. Like the marginal tax rate, yes. Yes, like we don't know.
Okay,
But
got
the
it.
best thing to do is check your BMI, put your height and weight in a BMI calculator.
Yeah.
The one that I use a lot is the National Institute of Health one, obviously because it's legit. But a lot of people say, well, I lift weights. Well, we kind of know when someone's in shape. You may think you're in shape, but
Yeah.
you lift weights and you still have a lot of subcutaneous fat, you're not really in shape.
Got it. Princess, let me
In fact, I
know
forgot the saddlebags, but I'm doing it now.
if you got all of that. Yeah.
Arm was
Dr. J has been in practice for
200.
over 20 years, about
Upper back,
23,
250.
so he kind of knows his stuff very, very well, has a lot of experience. Again, if that's something you're interested in figuring out for yourself, your BMI, there are calculators on the internet that you
We
can...
actually have one on our thing.
We
too.
do. We actually have one linked in our profile. Actually, if you're on TikTok, you'll find it under the name of BMI calculator. If it's not linked directly on our page, it's in our link tree. Yeah, let me know if you see it, and if you need any help navigating it. You'll just have to plug in your numbers, like your weight and things like that.
One minute, saddlebags.
Hey, Dr. J, is leptin like the chemical that satiates, like tells our body that we're full? Is it leptin?
Leptin, I think, well, there's leptin and ghrelin. I'll have to tell you, you have to look up both.
Okay.
But I think leptin and ghrelin, G-H-R-E-L-I-N, both are hormones secreted, I believe, by the pituitary,
Yeah.
and they tell you that you're full.
Right.
Now, people who are overweight have an abnormally high ghrelin and an abnormally low leptin, I believe. Check my facts.
Okay. I
There's
will.
an imbalance of those two hormones. What GLP-1 does is increases one of those hormones so that you're full immediately.
Really?
Yeah.
So it increases like the leptin
I
then?
believe so.
Okay, that's really
Fact
cool.
check me.
Okay, very neat.
Yeah. And we're also finding it in addiction medicine. That people on GLP-1s,
Yeah.
no drinking, they don't want to smoke, they don't want to do drugs, they don't want to do anything. Which is like me, maybe I had 2 or 3 drinks on a week. I really don't even want to.
You know, I read about that. That's really interesting.
Smoking, too.
Yeah.
It helps with smoking
Uh-huh.
cessation. Doc, did you hear about that?
Yes, it's a wonder drug.
It's literally a wonder drug. and
So
now
it's healthy. No, I'm just kidding.
it's a healthy drug. It's for your overall well-being.
Yes. Good.
So all your little weird habits, like I used to eat a lot of ice. I don't know why.
Okay.
Just an ice eater.
What?
I'm probably pregnant. But it really does help with your kind of weird addiction.
Yeah, that's really cool.
It's very cool. We're finding out a lot about this drug.
Hey Tom, sorry I didn't see your comment. Dr. Dr. J is currently in surgery. We've been in surgery for
In
about
fact, it's 100.
30 minutes, 35 minutes
We're gonna do
now.
100 per side.
This patient came in for breast augmentation, liposuction, lipo 360, lipo on the saddlebacks, so lipo in various areas. And we've only done liposuction so far. Dr. J has yet to do the rest of the liposuction on the patient's front side, so on the stomach, liposuction around the abdomen, the medial thighs, and the breast augmentation and the breast lift. So this surgery is going to take, again, we've only covered 35 minutes, so just covered a little bit of it so far, but probably take a few, I would guess, over an hour to 2 hours, maybe 3. I don't know. We'll see. Sometimes it gets pushed back. As you can see here, I'm turning the screen. I was going to attempt to. This patient had a lot of fat, and so because of that, Dr. J has to take a longer time suctioning that fat. So because of that, it may just take a little bit longer. Don't really know quite yet. And Dr. J still has to go in and do Renuvion in these areas where he did liposuction. So yeah, Tom, the patient is completely
Airplane back, sir.
this
Now we're gonna
patient,
start the Renuvion portion.
yes.
If you're on YouTube, you can see me switch between 3 different types of technology. The vaser, the power-assisted lipo, and the Renuvion.
So for those of y'all on TikTok, Dr. J is now moving on to Renuvion. So again, that is going to be that skin tightening. And so we'll take a break here shortly so that we can flip this patient over, and then we'll come back in here and go live and show the rest of this patient's procedures. So the rest of the liposuction, the breast augmentation, the breast lift. So if you guys have any questions in the meantime between now and then, you guys can always reach out to us privately, private message us. We do have a few ways you can reach us. You can start by filling out this form here that I have pinned on the bottom of your screen, and then somebody will reach out to you. Or you guys can text or call that number that's provided to you there in our bio. Reach out to us through social media. You guys can DM us on Instagram, here on TikTok, or leave us a comment, and we will surely get back to y'all.
$1.5. We'll do 2 arms though.
Alright, y'all, so we'll see y'all in the next surgery. Again, if you guys have any questions in the meantime, leave those questions in a private message or by filling out this form here on the bottom of your screen. Love to answer any questions that you may have, get you set up with our team, and we'll see y'all in a few